Hi guys, welcome back to Vitality Chiropractic Australia. My name's James. Today we're going to discuss the knee joint and common knee joint ligament injuries. So firstly, let's touch on anatomy of the knee. Unfortunately, I don't have a model of the knee, so you're just going to have to trust me and visualize this with me. I want you to imagine this is your femur. So this is your lower leg with your thigh. This is your tibia. So that's your lower leg, and they meet to form your knee joint. Now, there are various degrees of movement in the knee, primarily flexion and extension. So flexion is when we bend our knee, extension is when we straighten our knee. There are four main ligaments which support this movement. First, we have what's called your medial and lateral collateral ligaments, also your anterior cruciate and your posterior cruciate ligament. Each of those four have different responsibilities. Firstly, the collateral ligaments. The collateral ligaments sit laterally on the outside and the inside of the knee, and they prevent lateral slippage or movement of the knee. And then the ACL and the PCL sit within the knee joint, and they do a crossing type action where they prevent anterior and posterior slippage of the knee. So when you're running, walking, landing, these ligaments are under stress to prevent abnormal movement and therefore injury. So because our body is dynamic, our body requires movement, a consequence of movement is sometimes we have abnormal movement or too much movement. And that abnormal movement can lead to tissue injury, for example, knee joint ligament injury. So they're the four major ligaments. When you sustain an injury, this injury is categorized usually into grade 1, 2 or 3 type injuries. Of course, grade 1 is minor, grade 2 moderate, and grade 3 is severe. Now, depending on whichever grade you are, depends on the amount of treatment and rehabilitation which you require. Of course, if you're a severe injury, treatment's going to take longer, it's going to be more intensive. If you're a lower grade, your rehabilitation should be quite quick. So for a lower grade injury, common treatment strategies might be mobilization of the knee. So we want to return the knee to its normal movement capacity. Massage or soft tissue therapy to the ligament itself to help with healing and reducing inflammation. So techniques might be trigger point therapy of the ligament. We might use effleurage, needling. We may also use anti-inflammatory strategies, whether it's shockwave therapy, ultrasound, heat or ice application. Once our movement and pain is reduced, then we can progress you to do strengthening type based exercises, and then when our strength is back to normal, we can safely return back to normal activities and sports. Now, if you have a higher grade injury, surgical intervention may be required. However, it's important to discuss this with your doctor or a treating allied health professional. Now, I hope you found this video helpful, guys. If you would like any further information about knee injuries or specifically knee ligament injuries, feel free to please give us a call on 1300 003 777. Otherwise, have a great day.